This presentation is about different treatments for oropharyngeal cancers. The purpose for this presentation is to conclude with listeners knowledgeable for different treatments available for oropharyngeal cancers. This includes information and statistics. As a result of this presentation, learners will be able to differentiate between the types of surgeries used for oropharyngeal cancer. Also, learners will have the ability to analyze oropharyngeal cancer, such as what it is, where it occurs, and the features. Oropharyngeal cancer is a type of head and neck cancer. The oropharynx includes the soft palate, side and back wall of the throat, tonsils, and the back third of the tongue, shown here in blue. Sometimes cancer can occur in more than one place. This includes the oral cavity, nose, pharynx, larynx, trachea, or esophagus. Most oropharyngeal cancers are squamous cell carcinomas. With this cancer, squamous cell carcinomas are thin, flat cells that line the inside of the oropharynx. Comparing open surgery to non-surgical approaches, healthy tissue could be compromised by open surgery due to tissue distortion from dissection. Non-surgical approaches do not disrupt musculature involved in speech and swallowing. Transoral endoscopic surgery, or TES, is a non-surgical approach that occurs through the mouth and dissects tumor tissue. Avoiding most normal tissue makes TES minimally invasive. Also, avoiding musculature involved in speech and swallowing gives a positive outcome for not compromising one or both. This author explains the safety and effectiveness of TES by resecting tumors. Transoral laser microsurgery, or TLM, and transoral robotic surgery, TORS, are described as principal approaches with limited blood loss in comparison to open surgeries. In addition to gains of speech and swallowing, these improve the quality of life. Data in this research are percentages of speech and swallow impairment or normalcy. Based off the Functional Outcome Swallowing Scale, patients range from 88 to 100% normal post-operative swallowing or diet, and 70 to 100% normal post-operative speech. Only a few patients that completed TES, TORS, or TLM also underwent chemotherapy, radiation, or both. However, it was minimal compared to receiving this treatment without surgery. This makes these surgeries also more cost-effective. A study by Malong describes TLM as an endoscopic technique to manage oropharyngeal and laryngeal carcinomas. As described previously, TLM is also minimally invasive. In addition to previous positive outcomes, out of 39 patients, all 5 post-operative tracheostomy tubes were removed prior to discharge. 2 G-tubes that were required were both removed, only one being long-term. Some other effective notes about TLM: it has a shorter recovery time and less complications like blood loss in comparison to open surgeries. Radiation and chemotherapy can have side effects to voice or swallowing alterations that don't occur as often with TLM. Out of 39 patients with TLM, only 3 had local recurrence and 3 with regional recurrence. Most of these patients had an advanced stage cancer or refused to have chemotherapy or radiation. Over the years, there has been improvements to laser surgeries. Lasers that have a better line of sight can now reach the base of the tongue.